Good morning. I'm John Woodrich, CEO of Bryan Medical Center, and welcome to our press briefing on September the 8th. Today we have Dr. Trapp with us, who's going to be discussing sepsis and the relationship with COVID. And I thought I would share with you some of our numbers. We have tested 21,775 individuals. 2,427 are positive. We have 16 positive COVID patients in-house. 9 are from Lancaster County and 7 from outside of our county. 3 are in our intensive care unit, 2 in our progressive care unit, and 11 in our general care unit. And before I turn over to Dr. Trapp, we wanted to say our hearts and prayers are with the Herrera family. Mario was actually a off-duty officer for Bryan Medical Center as well. And I'm going to turn it over to Dr. Trapp.
Well, I was asked to give some information with regard to viral sepsis. A lot of people look at COVID-19 and wonder why some people develop relatively mild symptoms, but other people develop more severe disease, sometimes requiring hospitalization, sometimes causing or requiring additional life support, and even resulting in death. Most of us are familiar with many of the symptoms of COVID-19. Common symptoms may include symptoms like cough or fever. This is a viral process that primarily involves the lungs and upper airway. Other symptoms may be typical for other types of viral syndromes: muscle aches, body pain, headaches, shortness of breath, sore throat, and sometimes even GI symptoms such as nausea, vomiting, or diarrhea. One of the more unique things about this viral syndrome that's been identified is even a sense of smell or taste disorders. Now, these symptoms can be relatively mild, but in some cases, again, very severe disease. And we have really deemed this something called a viral sepsis syndrome. Now, people may ask, well, what exactly is sepsis? Sepsis is an extreme response or an inflammatory response to an infection. It may be due to bacterial infection, which we've typically been accustomed to treating. But in this syndrome, it's more of a viral type sepsis. And this results in a number of different symptoms. It may result in poor perfusion to the organs, which eventually may result in organ failure and subsequent death. Common symptoms of sepsis may include, again, high fever, increased heart rate, increased shortness of breath, low oxygen levels, low blood pressure, and even effects on the brain where it may cause confusion. These are all relatively attributed to insufficient blood flow to a number of different organs that results in tissue hypoperfusion, tissue malfunction, and tissue failure. Now, as far as what organs can be involved with regard to COVID-19, most typically we're seeing the lungs involved, and all of us are somewhat familiar with that. People develop severe respiratory symptoms of low oxygen levels. They may require extra support, either non-invasive support or even ventilator support. What's been really identified as more of a viral sepsis is identified that this virus affects other organ systems and can affect so in a very severe way. We know it can affect the blood with regard to inflammatory markers. It can decrease your number of lymphocytes within the blood. And importantly, we've identified clotting disorders and sometimes even bleeding disorders as the sepsis syndrome progresses. Heart dysfunction can occur with reduced cardiac function, inflamed heart muscle resulting in elevated cardiac enzymes in the bloodstream, and at times things such as myocarditis and cardiac arrhythmias may occur. Now, this inflammation also can affect a number of different organ systems, including the liver, the spleen, and the kidneys, all resulting in organ failure. Other organs that may be involved may include the brain, where patients develop progressive confusion or loss of thought patterns. And we've seen this also in our hospitalized patients with more severe illness. So who gets this and why? Identified risk factors for this severe form of COVID-19 or sepsis syndrome can be seen with people of older age, and that age may be as 50 or older. It may be patients with immunosuppression due to a variety of causes from medications or other types of illnesses. Patients with coexisting severe medical problems, including cardiovascular disease or cancers or respiratory disease. There may also be other genetic factors and environmental factors that have not been completely identified. And of course, if you delay in recognition of this sepsis syndrome, organs can be damaged to a point requiring higher levels of support. So this leads us really to the treatment for this sepsis syndrome. Treatment really is early identification and early support for the patients. So this may require hospitalization, even intensive care support that we can provide to patients as they weather through this inflammatory storm, if you will, of sepsis. In some cases, antibiotics may be appropriate when we think there are bacterial causes for the sepsis or infection, but in most cases with viruses, it's support. Now, there's a lot of research going on what types of support is best for these patients with severe viral syndromes. Right now, what we have access to at Bryan, we have a few different types of treatment options. One of these is an antiviral therapy called remdesivir, which slows the replication of the virus. We also use a therapy called convalescent plasma, which provides antibodies to help bind this virus and reduce its severity. And then also this inflammatory response of sepsis. A lot of research has been going on with regard to how do we reduce or attenuate this severe inflammatory reaction. Currently, we've seen improvement, and studies have demonstrated improvement with low-dose steroid therapy in the form of dexamethasone. There's currently a number of phase 2 and phase 3 clinical trials going on with other types of anti-inflammatory agents which may be helpful in slowing this sepsis inflammatory response. You know, those are the patients who actually end up in the hospital. There's all different levels of the sepsis, but as far as organ dysfunction, I would say it's a fairly high percentage of the patients who require hospitalization. Again, think of it this way. If you're requiring oxygen, that's already one organ that has some type of dysfunction. So patients who are hospitalized have a higher risk for this sepsis syndrome. Overall, this is probably less than 10% of the patients, but really those numbers are hard to come by because we really don't know how to categorize those patients with asymptomatic COVID-19 or minimally symptomatic COVID-19. So that really is your denominator. So it's a little hard to predict exactly what percentage of patients. I'm going to say overall small. Right now we have just a few patients on ventilators, I think 1 or 2 patients today on ventilators. So again, relatively small numbers requiring that level of support, but hard to overall estimate those patients based on the population.